but what can a country do right now?
Do you mean any country, or do you mean Belgium?
Well, Belgium for my country, but I think it's for any country.
Sure. Regional Director, would you like to take that? And then we'll go to Dr. Smallwood as well.
Thank you. So, in line with the statement that the joint statement by Dr. Tedros, WHO Director General, and me issued about a week ago, oxygen supplies are a top priority, because we should keep in mind that there are 3 parallel emergencies in Ukraine. At the top of the COVID-19, and people, particularly vulnerable, affected with the COVID-19, need oxygen, which is in short supply, and hospitals are running out already. Number 2 are the outbreaks of poliomyelitis. So there is a need for mass vaccination of the children. And the third is what's happening now with the military conflict. So in that sense, oxygen, life-saving medical supplies, trauma kits is one part. The second part is what we call health kits, because the people before and also now are passing away from what we call non-communicable diseases, heart conditions, respiratory conditions, diabetes, and this is exacerbated by what is happening. And the third component is on mental health expertise. These are 3 huge needs, but the umbrella is what I have consistently through all diplomatic channels been advocating for, together with the UN Secretary General, is what we call a safe humanitarian passage, a safe humanitarian corridor, because there are a lot of supplies in Lviv, but the key issue, as the Minister of Health of Ukraine, Dr. Victor Lashko, is continually drawing my attention, is that they need to arrive to the affected areas. So there, the international collaboration to have a safe humanitarian corridor of life-saving humanitarian supplies is the top priority.
Thank you, Dr. No, okay, great. That's fine. I hope that was good for you, Johanna. We'll go now. I have a question, Tarek, that's for you. I'm just jumping around a little bit because I appreciate that you might have to leave soon. There's a question, Tarek, for you. Could you clarify how the sort of tons of surgical equipment was able to reach Kiev, if it has reached there, and have the Russians let it through the various conflict lines?
Well, we are really looking into a best modality and what is feasible. Just yesterday, we had a meeting with the health authorities looking into how we can find this. We did get confirmation that supplies have arrived overnight to Kiev, and medical authorities there will dispatch them further. But again, without specifying precise details, we look into all possible modalities to do that. And as the regional director said, we need all UN system and member states as well to work to ensure there is unhindered access for all humanitarian assistance, not only health.
Thank you, Tarek. We'll go now to Jamie Keaton of the Associated Press. Jamie, please unmute yourself and ask your question.
Good morning. Thank you very much. Dr. Kluge, I'd like to just drill down on a couple of points you raised, if you don't mind. The first being that you mentioned the attacks on healthcare facilities, 16 attacks. Can you tell us where those attacks are coming from? Does that incapacitated the healthcare facilities? Just if you could tell us where those are as best possible. And then the second question I have has to do with the humanitarian corridors and the evacuations that are trying to be worked out and maybe are being worked out. What role, if any, does WHO have in that in terms of helping to participate and get aid, healthcare to people who need it, who may be evacuating from some of the conflict areas? Thank you so much.
Thanks, Jamie. So we'll just reverse this slightly and take your second question first, Regional Director.
Yes, hi, Jamie. So on the humanitarian corridor, as I was mentioning in the statement, we're working very closely with the UN special envoy for the crisis on Ukraine, Amin Awad. And this, of course, is discussed in New York, but on the ground, we are keeping also all diplomatic channels open because we need particularly both parties to agree on those principles. But meanwhile, as Tarek was telling, the clock is ticking. So in that sense, by hook and by crook, we need to get whatever we can already to the affected areas. When we know from previous conflicts, when more doors are being closed, the health diplomacy becomes the key one. Our principle is health for all, and the top priority is to get the life-saving humanitarian medical supplies to the people in need wherever.
Thank you, Regional Director. And on your first question there, Jamie, on the location of some of these attacks, I'm going to go to Dr. Smallwood. Dr. Smallwood, would you like to come in on that one?
Thank you, Banu, and hi, Jamie. Just to clarify that WHO defines attacks on health as any instance of physical violence, obstruction, or even verbal violence inflicted that interferes with the provision of health services to populations. And we've seen attacks on health happen in pretty much all conflicts. As you said in the question, we've had documented or verified 16 attacks with different levels of certainty. These have led to what we know of at least 9 deaths and 16 injuries, and they've happened in various large cities and around the areas of conflict line. And we are not specific in our public information about where those specific attacks are. Many of those have been reported in the public domain, but we keep some of those details not in the public domain for purposes of protecting healthcare and not putting them at risk. But this includes direct attacks against health facilities or hospitals that have been damaged. This also includes appropriating health infrastructure such as ambulances. It includes diverting ambulances and using them for purposes that are not directly related to the provision of healthcare. So that's what I can say at the moment, and we will continue to update those numbers. They've been increasing quite rapidly over the past few days. This is something that we have publicly on our surveillance system for attacks, which is online and tracks attacks in various countries and various conflicts around the world.
Thank you very much, Dr. Smallwood. Let's take a question now from our press corps here. David Williams of Xinhua News Agency. David, if you could ask your question.
Thank you. What does the WHO have to say about reports of racism towards non-European refugees escaping from Ukraine?
Thank you very much. Nice and short. Dr. Kluge, please, if you could take that first.
Any such instances are unacceptable. The non-discrimination principle is according to international humanitarian law, and it's very, very important. And there is no any deviation. I was mentioning that we have next week a long-planned inter-regional meeting on the new narrative on migrant health in Istanbul at a high level with participation of countries from the African region. The regional director of WHO, Dr. Maweti Chihedi, will be there. Also, the regional director of the Eastern Mediterranean region, Dr. Ahmed Al-Mandari, and we have countries from the Eastern Mediterranean. And this message also reached me, and we're going to put special attention in the outcome document of that meeting to put this issue very, very high. I can assure you that this office has done everything in its capacity to safely evacuate dependents of the African region and other ones, including personal support of many, many staff members to get them safely out with maximum dignity. Thank you.
Thank you, Regional Director, for that. I'd like to take a question here for you, Tarek, if that's all right. It's coming in from the Financial Times. There's a two-part question, actually, so we might come back to the studio for part of it. But they're asking whether we are speaking to the Russian and Ukrainian governments about the establishment of these humanitarian zones for the provision of healthcare inside Ukraine. Could you tell us a little bit about what sort of provision, what discussions are being had, basically?
Well, I think as Dr. Kluge has been saying, there has to be some negotiated agreement, including wider UN community and member states that are involved in this military offensive and others who can help. Our job as WHO is really to see if those safe passages are agreed upon. We will definitely use that opportunity to bring in medical supplies and do what we can to assist healthcare workers. But we are not going to wait for this to happen. We will try to see where we can go right now. We are doing internal planning here, trying to see what routes we can use together with the health authorities and to act as quickly as possible. But as Dr. Kluge was saying, this is more of a political issue. WHO is focused on providing assistance.
Great, thank you, Tarek. And that kind of leads us to the follow-on question, also from the Financial Times. And Dr. Kluge, I'm going to send this to you. They're asking, will Russia continue to be a member state of the World Health Organization? Over to you, Dr. Kluge.
So this is not a question to WHO. Any such decisions are being made by the United Nations. Our principle is to provide humanitarian assistance to all people in need. And this also includes if there are vulnerable people in the Russian Federation, which should be targeted, for example, by economic sanctions. If there would be a rupture of the supply chain, let's say, of life-saving cancer drugs or insulin for children. That is our duty and our mission.
Thank you very much, Dr. Kluge. I'm mindful that we have some questions that we received in advance as well, and I haven't taken any here. So I'd like to just bring in our colleague, Isabel Jordi Aguirre. Isabel, if you could maybe turn your camera on, that would be great. We've received a couple questions here from Wired Magazine. They want to know, so two questions really. What is the impact of the war in Ukraine or conflict generally on maternal and reproductive health? But also, how does conflict generally affect women and girls differently to men and boys?
Thank you very much. I think that the key issue around maternal and reproductive health was mentioned by the regional director, and that's pregnancy and outcomes of pregnancy. The UNFPA estimation of 80,000 women will give birth in the next 3 months in Ukraine means that those women may have moved from having a life-changing experience to a life-threatening experience, and may require emergency obstetric care. And we are talking about a country, Ukraine, where maternal mortality was already high in the past. But for those women in the move and women staying in Ukraine, that can be at life-threatening and risk to poor pregnancy outcomes. But and these poor pregnancy outcomes can also be related to violence. UNHCR projects that in July this year, we will have 4 million refugees, and that will mean approximately 1,000 births per week that will be anticipated. So that's what we have to ensure. What the regional director has said, sexual and reproductive health services should be at the core of our assistance to both women and refugees crossing the borders and also women staying behind. There is also the need of mental and psychosocial support for those women that are either having unwanted pregnancies and go through pregnancy outcomes that are that they have to deal with. And they can be also lastly some other impact on sexual and reproductive health, like the disruption of cancer screening, which means that the rates of cervical cancer will increase among the women on the move or women remaining in Ukraine. And with respect to the differences between how the conflict impacts on men and women, I think that we have seen very clear signs. It happens in most conflicts. First of all, the gender equality gains that we have had in Ukraine in the last years may be in jeopardy. we have seen a turn back to very traditional gender roles. Men are asked to stay and fight. Women go back to be the sole carers for children and for the elderly. That will have a big impact on the households. And it was mentioned already, the high number of female-headed households in the country. But there is also a big difference on the type of violence that men and women are exposed to. And obviously for men and for young men, being the fighters and being on the war has an important impact. But women have some specific exposure to risk, which is determined by intimate partner violence and the fall down of the services that are protecting them. Sexual violence that may be used in many cases as a tool for conflict areas. And unfortunately, we have seen it in many countries. But also the risk that trafficking of women may increase in the region. We are seeing that there may be signs in a region that had experienced that in the past. But it's also a big difference on the impact on mental health. And I think that mental health services need to be prepared to address how men and women react to different stress and conflicts due to the normal roles. We see it in times of no conflict, where we have high indices of prevalence of suicide among men and depression among women. I think it's important that our mental health and psychosocial support is prepared to address these differences. And lastly, I think that it was also mentioned by the regional director, and it's related to going back to the traditional norms and roles. We have seen that women have been put aside on the leadership of the decision making. So we have a representation of 50% of the population making decisions for 100% of the population. And I think that needs to change. Thank you.
Thank you very much, Isabel, for that comprehensive answer. Let's take a question from the press corps now. Jan Dirk Herberman, if you could unmute yourself and ask your question, please.
Can you hear me?
Yes.
Okay, great. Yeah, Jan de Kerberman, I write for various German language media. I have a question for Dr. Kluge on the spread of infectious diseases, and especially COVID-19, measles and TB. Now in this situation of war, of escalating war, one should say, is there a danger that these diseases will completely spiral out of control inside Ukraine? And secondly, the people who are forced to flee Ukraine, the refugees, I suppose some or many of them are infected with these diseases. Is there another danger that they might sort of export these diseases into other countries, and how do you want to handle this situation? Thank you.
Thank you, Jan. We'll go to Regional Director and then Dr. Smallwood as well on this. Thank you.
Thanks, Jan. So the infectious disease is part of the complex picture of health needs of the refugees. There's the mental health, there are the chronic diseases, and indeed, as you say, the infectious diseases. Number one, the COVID-19. I myself was in Poland. In fact, we're communicating with all the health ministers of the neighboring countries, including Moldova. And all those countries reassure me that there is no shortage of COVID-19 vaccines, which is a very good news. Then second, there is the routine immunization, as you mentioned, on measles, but also on poliomyelitis. And indeed, Ukraine had a substantial burden of tuberculosis, HIV, and hepatitis. It is extremely important what you mentioned, that there is any misunderstanding or discriminatory acts in receiving countries. We have this experience from the previous migrant waves, that if there is outbreaks in receiving countries, it seldom comes from people entering the countries. So what is needed from the origin countries, what is needed are good screening protocols, and then obviously continuation of the treatment. So this is something that countries, WHO knows very well, is well-established protocols. And actually, it may be really a golden opportunity for refugees to get finally a full treatment regimen of these diseases, which either are curable or manageable as a chronic disease.
Thank you very much. Dr. Small, would you like to add anything?
Yeah, thank you. Just to comment on the COVID-19 situation in Ukraine, of course, as the regional director noted, remarkably, there has been a continuation of the reporting of cases of COVID-19 and deaths in Ukraine, but we're also seeing severe strain being placed on those systems. And as for other diseases and other health issues, conflict does several things. It disrupts services. It decreases the ability of healthcare workers to provide quality of care. It creates new health threats that interplay with existing ones, and it exacerbates existing health threats. And it places obstacles in the way, and Tarek was very clear about this. People are not seeking care because they're afraid of the security situation. Healthcare workers are not able to reach their places of work because they're concerned about their own security and taking incredible risks. So it's amazing that these things are continuing, and we would encourage all of our colleagues inside Ukraine to keep on going with the systems that are in place to manage COVID-19, to manage the ongoing polio outbreak, to continue the ramping up vaccination of vaccine preventable infections across the country. Yes, this poses a huge threat, and this is a core role for WHO to become involved in supporting these things to continue. In terms of refugees moving into other countries, it's not the refugees that are a risk to health. Countries really need to focus on the infectious diseases themselves and ensure that adequate levels of immunity and control programs are available to their own populations and then provided to all of the refugees entering those people in an equitable manner. It's really important that we look at the baseline prevalence of various diseases. As the regional director said, we know where there's high prevalence, we know where there's going to be needs, we know that 1 in 5 people affected by conflict will need a mental health support. So the needs are very clear and we need to respond to them, but critically in Ukraine, please continue to keep all of these programs going.
Thank you very much, Dr. Smallwood. Let's take another question from the press corps. Naomi, hi, how are you, from the BBC? If you could unmute yourself and ask your question.
Yes, hello. Given that surveillance of COVID-19 is continuing, do we have any sense of whether those cities where people are huddled in basement shelters are seeing more hospitalizations and deaths, or is it too early at this stage to extrapolate on that?
Thanks, Naomi. Let's go straight to Dr. Smallwood on that.
This is something we're looking at very closely at the moment. And in fact, what the information that we have is that COVID-19 hospitalizations in the past couple of weeks have decreased, not increased. The reasons for that are still not quite clear. And it could well be that people have been discharged early from hospital to make space for other health needs. People may have left hospitals voluntarily, and people in hospital may have died. We've made it very clear that oxygen distribution for COVID-19 in hospitals is a critical need at the moment. And without good oxygen provision, we will have more deaths. Of course, people congregating on the move in environments that are overcrowded are going to lead to increased transmission of all communicable diseases, included COVID-19. And we can see very clearly from the images that we're seeing that people are not focused on their own protection in that regard. It's they're prioritizing their physical safety and their well-being. So we need to reinforce these principles. We also need to reinforce these principles of infection prevention and control, also where humanitarian organizations are coming in, where we have NGOs, international organizations setting up camps, helping refugees in neighboring countries. We all need to be very cognizant that COVID-19 is circulating widely across Europe. And for Ukrainians, it represents a specific risk because of their low vaccination uptake for COVID-19. 34% of the population, adult population, has completed their vaccination series. Only 1/3 of over 60s have. So these populations are at especially high risk of severe COVID-19, and we need to focus on protecting them from us, but also themselves.
Thank you very much, Dr. Smallwood. I'd like to take a question here that we received in advance, moving to the issue of refugees again. And Dr. Kluge, we've discussed discrimination and racism, but we've received a question from Ed Holt at The Lancet about the specific health threats that we anticipate refugees will be facing as they leave and settle in different countries.
Thanks, Ed. The needs are quite clear. It's a complex picture. To start with the mental health, what Dr. Smallwood was mentioning, in any conflict, about 1 out of 5 people is facing mental ill health. And the longer, particularly children, are exposed to conflict, separation of families, witnessing atrocities, then the long-term impact is increasing. So that's definitely a top priority. Number 2 are the chronic diseases. We call it non-communicable diseases. For example, the elderly with diabetes, where there may be a shortage of insulin. Straight after the press conference, I'm going to discuss this with the president of the board of the World Diabetes Foundation, who is here in Copenhagen. Then we have, of course, a lot of hypertension, cardiovascular disease events, which are exacerbated due to the situation. We see, I saw myself at the border last week, the effects of hypothermia, because it's really a cold weather and people travel hours and hours and have to wait at the border hours and hours. And then, as we discussed at length already, the infectious diseases going from the COVID-19 to routine immunization like poliomyelitis and measles, to the tuberculosis, HIV and hepatitis. But the good news is that there are protocols. There's a lot of hospitality and readiness. I visited also the hospitals at the border in Poland. But again, I come back to the same point I have been making during the COVID-19 briefings. We have to take care of the mental health of our health workforce. When I was talking to the medical directors of the hospitals, they were telling Dr. Kluge, we are so much ready to receive the refugees and take care of them, but our workforce is exhausted after 2 years of COVID-19 pandemic, and now this is coming as well. So mental health for the workforce becomes even more important in this office here. Thank you.
Thank you, Dr. Kluge. Let's take Jenny Lay Ravello, I believe from Devix. Jenny, please unmute yourself and ask your question.
Hi, thank you. There was a mention earlier about the need for mental health expertise. I just want to clarify if that's inside Ukraine or at the border, and are there other health expertise needed at the moment inside Ukraine? And a second, related question is, do you have concerns of potential healthcare worker shortages, and what's the plan to address that if that's the case? Thank you so much.
Thank you very much, Jenny. We'll go to Regional Director first on that one.
Jenny, good point. We're concerned about healthcare worker shortages before the military operations and before the COVID-19. With the demographics in our region, we'll present at our region committee, which is our annual governing board meeting in Tel Aviv in September, a state of the art on the health workforce. And obviously this is being exacerbated. So we have to look at all possible means. I will give one example. I was at a train station in Rzeszów at the border of Poland, and there the medical students were asked to do the triage and referral. The same for the midwife. So emergencies stimulate innovation. And then we need to look at task shifting, which tasks can be shifted from the medical doctor to the nurse, to the community worker, and also to digital tools. This is on the health workforce. Thank you.
Dr. Smallwood, if you would like to come in on that at all.
And just very specifically on what we're doing to scale up mental health support, both within Ukraine, but also in the countries that are receiving large influxes of refugees from Ukraine. We've already deployed mental health expertise to surrounding countries, and we're beefing up the support through our Ukraine country office. What we know is that much of the time during conflict situations, mental health and psychosocial support is crucially important and sometimes needs to be delivered through primary healthcare mechanisms. And we spend a lot of time training our workforce at the primary healthcare level to be able to cater and address the mental health needs of these populations. We're also bringing in people with direct experience in Ukraine, having worked in Ukraine, Ukrainians themselves, to help local authorities tailor the mental health support directly to those refugees. This needs to continue and be scaled up over time. The mental health needs will only grow as the conflict continues.
Great, thank you very much. And actually on this note, I'm going to close this press briefing for today. Thank you very much for all the panelists, Dr. Kluge, Regional Director, Dr. Smallwood, Tarek, thank you very much for taking the time from your busy day in Ukraine, and please stay safe out there. And thank you to you, the members of the press, for joining this press briefing today. If you do need additional follow-up, please do just get in touch. Happy to answer your follow-up questions using the email that was provided in the invitation. And as always, stay healthy. Take care. Bye-bye.